Hi, I'm Dr. Charlie Liu and I'm one of the GPs at Summertown Health Centre, and today I'm going to be talking to you about how to manage hay fever. So we're in the middle of May of 2022 at the moment. A lot of people are having a bit of a miserable time with their hay fever. We're smack bang in the middle of tree pollen season, and we've got the grass pollen and weed pollen seasons coming up later this year to look forward to. If you're a sufferer from hay fever, as I am, you know that it can be a really debilitating, horrible condition, and of course it does affect a lot of children as well. There are studies that show that children who suffer from hay fever can have significant drops in their grades. So hopefully I'm going to be able to give you some information on how to manage that hay fever properly so that you don't have a miserable summer and spring and autumn. So this series of videos is going to be divided into antihistamines, mast cell stabilizers, steroid nasal sprays, nasal rinses, pollen avoidance strategies, and then finally a short little bit on what you can actually get from your GP if none of those strategies have worked for you. So in this first part of the video, I'm going to be talking about using nasal steroid sprays, and these are a really important and effective part of hay fever management, and it's a real shame that we get a lot of calls into the surgery about hay fever, and people have often tried these sprays and they haven't worked for them, and it's a real bugbear of mine that when you pick up a bottle of some Beckinase from the supermarket, it doesn't really come with any instructions about how to administer it and use it effectively. So a lot of people are using these medications and spraying them in the wrong place, or they're not using them consistently and they're failing to see any benefit from them. But if used correctly, they are a really important cornerstone of hay fever management, and they're as important, or if maybe even more important, than using the antihistamines. Before I launch into how to use the spray effectively, I'm just going to spend a little bit of time explaining what hay fever is, what allergies are, so you can understand why it's important to use these steroid nasal sprays. So the immune system is designed to fight off harmful bugs, including things like parasites, and sometimes it gets a little bit confused and it will start to fight off harmless things like pollen or insects or peanuts even. So this is a little bit like if you have a smoke alarm in your kitchen. It's designed to go off when there's a fire in your kitchen and warn you of the danger, but in this case it's a little bit like you've been making some toast. It's gotten a little bit burnt and then the smoke alarm goes off. There's no actual danger there, it's all harmless, but the smoke alarm is going off anyway. Now, when the immune system activates, it activates these things called mast cells, and these release a chemical called histamine. Histamine, it then goes into your bloodstream and it's responsible for swelling, itching, nasal discharge, mucus production, all of the symptoms that you're very familiar with hay fever. So antihistamines unsurprisingly work by blocking the effect of that chemical, histamine. In our analogy using the smoke alarm, it's a little bit like you've burned the toast, the smoke alarm has gone off, and the antihistamines are a little bit like putting some earplugs in. The alarm is still going off, you just can't hear it anymore, so it's like blocking the symptoms. Whereas with a nasal steroid, it works on a much more basic level, so it actually damps down the immune system and it stops the histamine from being released in the first place. So it's a little bit more like switching off the fire alarm rather than just putting in earplugs so you can ignore it. But there are two main reasons that people don't think that nasal steroids work. Number one is that they do take a little while to get working, and this can be anywhere from a couple of days through to even a couple of weeks. And number two is that they're just putting it in the wrong place and they're not tackling the nasal mucosa exactly where they should go. Now, when people open up a bottle of nasal steroid, a lot of people end up just using it in the wrong way and not getting any benefit, even if they use it consistently. The correct technique is slightly different from what most people do. What most people do is they grab the steroid, they pop it up the nose and they spray a couple of times, and they spray directly upwards. Actually, when you look on the inside of the nose, most of the nasal cavity is behind the face, so you actually want to aim slightly backwards rather than upwards. And the sinuses, which sit behind the cheeks, do connect to the nasal cavity, and you want to try and get a little bit of steroid in there as well. So you don't want to aim towards the midline, which is the septum, because that can also bleed if you put too much steroid on it. You actually want to aim slightly outwards. If you want a marker, you can aim for the tip of the ear here. If you aim in that direction towards the tip of the ear, you'll be spraying in the right direction. Easiest way I tend to find is that if you hold it in your right hand and left nostril and you lean your head forward a little bit, again point it slightly outwards towards the tip of the ear, give a spray. Try not to sniff at this point, which is really important. If you sniff, all of that steroid is just going to go down to the back of your throat or into the lungs. It's not going to stay in the nose where you need it. So try to avoid the urge to sniff or to blow your nose instantly or to sneeze. If you feel like you're going to sneeze, at least hold the the nose close and try and sneeze through your mouth if you can, so you're not just blowing it all out. You can also put a finger here directly underneath and press real hard, and sometimes that helps to suppress the urge. The important thing I forgot to mention is before you put the nasal steroid in, make sure that at least you blow the nose, and if possible, do a nasal rinse. The next video that I'm going to do will be on antihistamines and mast cell stabilizers, but the video after that will be on nasal rinses, which you can buy over the pharmacy, and I'm also going to give you a recipe on how to make your own. So I hope that's been useful. Do please make sure that you use these and use them properly and consistently, and you'll have a much better summer.